So let's see if I can answer that question. What do we need to do? This is more of some things like which are still in flux. And so when we think where we started out with AI-enhanced medicine, there's like a sort of also still not a real consensus where we are currently in this evolution, in particular in breast imaging, because there's a lot of AI in certain aspects already out there. In some there isn't. And also when you think about, like, we started out with AI officially like more than a decade ago with CAD. So are we at the final frontier yet? Yeah. So because some people think we already are. I personally think we just got Captain Kirk into the orbit finally, but there's still a lot of things we need to do. And there I will try to put out the considerations that are there. I will not necessarily talk about all the applications that are out there, because there's a separate lecture on the evidence, on what currently are the use cases. And challenges for AI-enhanced medicine in general, and as in breast, we really do have a lot going on in that field. There are challenges. One is the over-enthusiasm. So like the rise of the machines will help us and create unrealistic expectations. That to some extent also happened when you think about when the CAD systems came along. We were like, oh, wonderful, in screening, we will have second readers, we will not read cases anymore. And then basically CAD imploded because it was creating even more recalls, yeah? I mean, this is like when you think about, there's now the Amazon Astro out there, though you can only get it by invitation, which is supposed to do a lot in your household. On the page, the description, what it actually does for you is not really clear. I still don't think that even if I had an Astro, it would help me with everything in my household that I wanted to be done. So the problem with this unrealistic false expectations and a false sense of what AI can help us do for us, then as the disappointment is even bigger when we realize that the Astro just rolls around our apartment and is not cooking a pizza for me. So the next thing is the problem of the fear. Yeah. The opposite, the rise of the machine. Should we be afraid? Should we be replaced? Yeah, this is basically the exact opposite. And that the problem with the fear, with the will we be replaced? Will they take away our jobs? Yeah, is that then there's over-restrictive guardrails that actually can impede the implementation of AI. I personally think over-enthusiasm and fear are sort of manageable challenges for the implementation in AI. I think rather that managing change, and my personal experience, it has been that managing change, if changing anything, the slightest bit of how things are done, is usually a gargantuan task. And you have to involve all stakeholders, yeah. So that is not just like we radiologists probably really have a good idea what we want and what AI can do for us, but you will also have to talk about with insurance providers, with your referring physicians. So it will be a lot on different levels. You have to manage change, and I think a lot of thought has gone into how do we get it in our workflow, and then the whole Pandora's box of ethical challenges, legal challenges. There is thought going into that, and I will explore that in detail. But there's not so much. Not that much has been done than in our actual world.